Hi, everyone. Thank you for joining us today. My name is Chase Koob. I'm one of the program managers for community outreach and school-based community health workers with the Telehealth ROCKS program. We are a program based out of the Behavioral Pediatrics Department at the University of Kansas Medical Center. Today, myself and four of my colleagues will be discussing school-based community health workers and how they are working upstream to better meet the needs of students and families. Next slide, please. We have four presenters today from multiple school-based programs working in the Fort Scott, Kansas School District. Heather Walker-Shepard is a school-based community health worker working in the district. We also have Belinda Pitts, the mental health intervention team liaison for the district. We'll also be joined by Brad Girard, the program director for the CHASE program, as well as Colette Lee, the director of patient engagement for the regional FQHC. Each of the presenters will introduce themselves throughout the presentation and share more about their program's work and how they are working upstream to better meet the needs of students and families. Next slide, please. Here's our agenda for today's presentation. We're going to start with an overview of the Telehealth ROCKS model and approach. Then we'll discuss why we utilize school-based community health workers. Then we will get into Fort Scott's School District's comprehensive approach to working upstream. And finally, we'll end with community health worker supports and sustainability. I encourage you to add your questions to the Q&A function throughout the presentation. We have built in time for a brief Q&A at the end of the session. However, if we do not have time to get through all the questions asked, we will curate a list of the questions provided in the Q&A and send out our responses and our follow-up resources. Next slide, please. This is an overview of the Telehealth ROCKS approach. Telehealth ROCKS stands for Regional Outreach for Community, Kids, and Schools. We are a school-based behavioral health program focused on meeting the needs of both children and families living in rural communities. Schools are often thought of as the beating heart of rural communities, and the Telehealth ROCKS approach centers school district and community engagement to support the whole family and create sustainable community change. Next slide, please. So now to get into the why and the how. We believe we can create schools and communities where every child and family has the resources they need to be successful. We will do this through transforming communities through comprehensive and integrated approaches. Our presentation today will highlight exactly that, a comprehensive approach to meeting the needs of children and families by amplifying existing resources in the school district and community and creating innovative solutions. Next slide, please. So these are the key concepts to the Telehealth ROCKS model. We are school district driven and centered. We provide services across universal, targeted, and individual levels, understanding that clinical services with focus on social determinants of health are a behavioral health intervention. We are trauma responsive. We believe that by mitigating the impact of trauma, we also need to work to reduce its occurrence. Next slide, please. We provide training and resource needs based off topics identified by our partners. We continue to create integrated systems, and we provide services to students in populations with specialized needs. Next slide. The key to success for our program is building strong partnerships across the local, state, and federal levels. We rely on our partners to provide their experience and boot on the ground experience. We have provided partnerships with organizations serving minority and special populations, including the State Parent Training and Information Center, helping families navigate the system of disability services, organizations focused on supporting justice-involved youth, the State Child Welfare Agency, organizations supporting foster care youth, suicide prevention and advocacy organizations, those focused on substance abuse and misuse, and many addressing youth health and behavioral health issues. We currently partner with 12 school districts across the states of Kansas and Missouri. We will continue to work to add partners until we have everyone at the table. We know we can't do it alone, and we know it's going to take all of us. We need to continue to collaborate and share the resources available to improve the health and education outcomes in our rural communities. Next slide, please. This is our collaborative work model. We provide clinical services across the MTSS pyramid, trainings across a wide range of behavioral health, social determinants of health, and education topics to a wide range of workforce professionals, student prevention services, and engagement and family support, As you can see, students and families are at the heart of everything we do at Telehealth Rocks. Next slide, please. So why school-based community health workers? A community health worker can help address all of the things that stand in the way of a child and family's education and ultimately their success. Looking at the social determinants of health model to the side here, school-based community health workers can help address needs across healthcare access and quality, neighborhood and built environment, social and community context, economic stability, and education access and quality. They focus on these social determinants of health needs while also developing and maintaining school, community, and family relationships and resources. Another benefit to having school-based community health workers is allowing the districts to have flexibility in how they utilize their community health worker. We have school-based community health workers focusing on attendance and truancy, creating mentorship and informal counseling groups for middle and high school students that need extra guidance, working with community partners to support students at risk of involvement with the justice system, and bilingual community health workers to support recently immigrated students and families. Most importantly, school-based community health workers are there to advocate for the needs of the family and help create communities that meet and respond to their residents' needs. Currently, Telehealth ROCKS has 10 school-based community health workers across 8 districts, and we are working to add more. Next slide, please. So we'll talk about the multi-tiered system of supports. When we talk about the MTSS pyramid, we see family, school, and community partnerships as the base of this pyramid. School-based community health workers can help support and build each of these family, school, and community partnerships and support the work of each tier. School-based community health workers help advance the services of each tier by supporting the whole family. Next slide, please. Finally, I wanted to end with a quote from a director of special education in one of our partner districts. This quote highlights the adaptability of school-based community health workers and how they can help alleviate the burden on school district staff. I love that he calls the CHW the Swiss Army knife of the school staff. Next slide, please. So now we'll talk about the collaborative work happening in the Fort Scott School District. I'll turn it over to my colleague, Heather Walker-Shepard, the school-based community health worker in the district.
Next slide, please. My name is Heather Walker-Shepard. I do have a master's in social work, and I am a school-based community health worker for Fort Scott Schools USD 234, and I am employed by Community Health Center of Southeast Kansas. Next slide, please. What is a school-based community health worker? A trusted member of a school district that understands the issues students face. They can improve students' overall health and well-being by finding services and solutions that will allow students to meet their personal goals. Next slide, please. What can a school's CHW offer to students and families? I can assist families and their students with to work through any goals that they may have. I can assist students who are involved with truancy and assist with removing those barriers that may be keeping them from coming to school. Maybe the family doesn't have a vehicle. Maybe they don't have an alarm clock to get themselves up in the morning. There could be a lot of different barriers that we don't realize that could be keeping these students from coming to school. I can also assist families with food insecurity by referring them to resources within the Fort Scott district. I can assist with housing, transportation to appointments, finding employment if needed, which I can use resources like Kansas Works to assist with that. I can find resources if there is a head lice or bug infestation in the home. I can assist with finding resources if their utilities have been turned off. I can also assist with clothing. I can go into home and I can assist with parenting skills, teach them how to budget their money if they have food stamps so they don't run out by the end of the month. And I can work on improving their social skills, goal setting, and much more. Next slide, please. These are my collaborations to foster hope and change within the family and student. The first one I'm going to talk about is the USD 234 Mental Health School Liaison, which you will be hearing from here shortly. It's a close collaboration with me and when we share an office together in one of the schools to meet the needs of all the students. Each of us will receive a referral, and then we'll do collaboration on that family to ensure that all needs are met for that student and family. We also have monthly student meetings with the superintendent. School counselors are there, school principals, area mental health providers, and community resources. We all come together once a month and discuss students of need. The focus is to ensure all needs of the student are being met, and a plan is put in place by all involved to enhance well-being and promote their overall experience in school. I feel if those needs are being met, there's a greater chance of success. Next slide, please. I receive referrals from school-based administration, counselors, teachers, and nurses. They may refer a student or family to me. I can also assist with high-risk students that are non-compliant with virtual learning, truancy, absences, social determinants of health, as Chase talked about earlier, in-home family support. I can assist them with medical, dental resources through Community Health Center of Southeast Kansas or whatever facility they would choose. I can assist with insurance enrollment, where I can do a predetermination and they can be enrolled in one day and have insurance that day, among other resources. And we also have other resources that promote the overall well-being of the students enrolled in the district. Another collaboration is with the Chase program, and you will hear about that more later. They provide interventions for at-risk students in both the middle school and high school. High-risk teens are provided support, encouragement, varied tools, and methods to enhance learning and coping skills in social settings and activities designed to promote self-esteem and provide opportunities for friendship. Community involvement is essential to their growth and self-esteem to encourage positive interaction with family, friends, teachers, and community. Through the Chase program, we did a community garden here in Fort Scott, and it was a collaboration with a lot of different resources within Fort Scott. You'll hear more about that later. Next slide, please. Other collaborations are with Sparkwheel. It's a school-based program working with students and families to remove barriers and fill gaps and be the students' personal champions to help students thrive. I will work alongside the staff in schools as well as other community partners to help students reach their full potential. I also work with the Family Resource Center based out of Pittsburgh, Kansas. However, there is a family response advocate here in Bourbon County that ensures all needs are met to enhance the quality of life for the student and the family. We work together with finding resources, whether monetary or tangible, which will allow the family to stay intact and not disrupt the student's education or family bond. Another resource we have is agencies working together through DCF. Community partners come together monthly to discuss needs and resources for families in the Southeast Kansas area. This collaboration has a Teams page where anyone within the group can discuss an issue or concern with a family and work together to find a solution. You can put a question in there during the day, and then you could have many resources come to you within the next 10 minutes. So it's a very good resource. Next slide, please. Next, you will hear from Belinda Pitts. She is a mental health school liaison for USD 234.
Hi, good afternoon. My name is Belinda Pitts, and like Heather said, that I am the mental health school liaison for USD 234 in Fort Scott, Kansas. The MHIT program is a partnership between our school district and the mental health providers that connects students with school-based mental health services. As a liaison, I support teachers with students who could benefit from these services and work closely with counselors, administrators, the community health workers, and parents to provide comprehensive wraparound support for families in need. Next slide, please. So the MHIT program, our mission is increasing our students' academic potential. What we do is connecting mental health providers to our schools and then our students to those mental health providers. How we do this, it's customized school and behavioral health services. And why we do this is prioritizing our students' mental health needs. Next slide, please. Our mission. The MHIT program is dedicated to improving each of its students' overall academic potential by breaking down barriers to mental health services to those who need it most. And we know that's hard sometimes to break down those barriers. What we do is under MHIT, school districts employ school-based liaisons who identify students needing intense behavioral and mental health services, and we link them to local service providers. How we do this, each of MHIT's 90 school districts is unique and they customize their programs to fit the needs of their individual students, their families, and their communities, which is really a great thing. You just figure out what you need in your community and you set the pathway and do the connecting. And why we do this? This program is innovative, preventive, and it improves the lives of our most precious resources, our children. Next slide, please. So as a school-based liaison, I'm the bridge. The therapist, we have school-based therapists that are in each of our schools, and they provide individual therapy sessions and establishing treatment plans. Then we also have our case managers, and they work with the therapist and school staff to implement the treatment plans and goals in the school and family settings. Next slide, please. You'll see a picture of our state, and in Kansas in 23-24 school year, the MHIT program statewide served over 7,000 students in over 90 school districts, and we have 200 school-based liaisons in our state. I'm really proud of that. We've served a lot of students and helped a lot of families. Next slide, please. So why do I do this? My work is driven by a deep compassion and commitment to the students and families in our community. I believe that every child and family deserves the support they need to thrive, not just in terms of mental health, but with comprehensive wraparound services that addresses their overall well-being. Connecting them with these resources is my way to help create a stronger, healthier community where everyone has the opportunity to succeed. Next slide, please. And here's Brad to talk about the CHASE program.
Thank you, Belinda, and everyone. It's great to be here, and I work pretty closely with all these people, and everyone's working really hard to support families and youth, so this is cool to be able to do this. So yeah, my name is Brad Girard. I'm the program director for CHASE, and CHASE stands for Community Honoring Adolescent Success in Education. We're based in Johnson County in the Kansas City area, but we've been able to grow our program to Fort Scott, which is where Heather and Belinda are tuning in from. And CHASE is only about 4 years old as a program, but Families Together has been around for over 40 years. So earlier, CHASE talked about partnering with the Parent Training and Information Center, and that's what Families Together is. We're the federally designated PTI and supporting families with family members with disabilities. CHASE came to be because CHASE the program, not CHASE the person. I still get confused too sometimes. CHASE came to be because the Justice Department, the Department of Corrections here in Johnson County, wanted to partner with Families Together to support youth with disabilities who are in the justice system, because a lot of times their IEPs and 504 plans can fall through the cracks. And so that's where we kind of fit in. Then our work has kind of blossomed to grow to support other people with different experiences like foster care and truancy and stuff like that. Next slide, please. I like to put this one up because I love my team, gosh darn it. And these are the people carrying out the great work that we're doing. Leah on the left, she's a parent of a 32-year-old with significant needs with his autism. And she tells a beautiful story about his life. And her other son was just as involved. And so she does a lot of the parent support. And she's walked many miles in those parents' shoes, and she really gets it. And then Jordan and Natalie do youth support. Natalie is our Southeast Kansas support person, and she's bilingual, which is great. And she's the one who works with a lot of the students in Fort Scott. Next slide, please. So what is it that we do? It's three main components. One, like I mentioned, is the family and parent support with educational stuff. So we talk to a lot of parents about making sure that the IEP plan is aligned with the strengths and interests and passions of the student. And, you know, with justice-involved families, a lot of times we're talking through the best alternative placements for someone who's been expelled, things like that. And then with the youth supports, that's been a huge focus of ours over the last couple of years. I'm going to talk about that on the next couple slides. But lastly, we do community events. We call them pro-social events. And we understand that it's not easy for families to always pay for and organize fun stuff to do in the community. And so we kind of take that upon ourselves, and we just like to do community events, get people out, have a good time. And that can be as simple as something like bowling, or sometimes it's more outcome oriented, like a collaboration with VR and pre-ets to talk through employment. So, but that's a regular thing in our program as well. Next slide, please. I already described reports, but here are just a few of those. IEP and 504, alternative settings, suspension and expulsion kind of stuff. If you go to the next slide, you'll see a parent's comment here, and I highlighted guidance, understanding, and encouragement. Families Together really tries to encourage people, because these parents, especially, and the youth, of course, but the parents too, have a lot on their plates. And so I love this quote because it really shows the value of the work. And then the next slide shows another quote, and this is about Leah, and she's our parent support person, and she actually made it to an IEP in the afternoon after getting the referral in the morning. So that just kind of shows her dedication. But yeah, essential to helping me understand the school and IEP process. That can be the difference between your child succeeding in school or not. So that's awesome. Next slide, please. This is a snapshot of our youth work. It's an 8-week program, and we try to touch on all kinds of health, and we also really try to focus on communication and creativity. So right off the bat, you know, we want to talk through how to develop a practice of positive self-talk and gratitude to get into our mental health. We also have community-oriented goals. So we have a random act of kindness challenge where we challenge the youth to get out and do a random act of kindness. And we do that within the SMART Golden Model so that they can kind of learn some of those leadership skills. Next slide, please. We do a lot of this work with our Chase Your Dreams podcast. This is one of the ways that we've tried to stay cool and hip with the teenagers. And we have these 5 to 7 minute long episodes where they can learn things about self-talk, connecting to nature, self-advocacy, which is really important, breathing techniques in case they're ever needing to self-regulate if they're in an overwhelmed place. So yeah, we use a podcast as one of our main educational tools, which is a lot of fun. On the next slide, we'll talk about this a little later, but we did do a really cool community garden project. Both, I think Heather and Belinda mentioned that, and here's some pictures from it. These are students and youth in our program getting their hands in the dirt. And that was a fun one for us because we really did come together to do something that aligns with all of our missions to just create healthier living for us and for the families that we support. So on the next slide, there's a few youth quotes. You can take just a second to read a couple of those. If this was therapy, I'd go. That one makes me laugh every time. All right, so we are going to talk through a few case studies, some of the actual youth and families that we supported as a team. So I'm going to pass it back to Heather for the next slide to talk through case study 1.
Okay, so the first case study is about a 16-year-old student who was living with her grandmother, and her mother passed away right at the beginning of school. I had started working with her at the end of last year, and she was missing a lot of school, had a lot of truancy issues, was sick a lot. Her grades are very poor. And so whenever Brad approached the school district about the Chase program, I felt that this student would benefit from this program. And she was like the first student we had in this program. She still struggled with the attendance after the loss of her mother. She had poor grades, and her father lived out of state, and they had very little contact, and her siblings were out of state as well. So she had her grandmother here, but their housing wasn't stable and things like that. So I assisted that family with a lot of different resources to improve the quality of life for the student. And of course, the Chase program was it too. So next slide, please. And I believe it's going to go back to Brad.
Yeah, so I just wanted to highlight some of the progress that we made with this student. And I chose this graphic to put all of our hands kind of in this big teamwork image here, because it really was all three programs and organizations coming together to help this person. And one of the things that we love about Chase is that it can be virtual, but that can also be a challenge too. In this case, the student's grandma didn't have great technology, and the student, just having lost her mom, was not in a great place to initiate her own meeting times and stuff. And so we really relied on Heather and Belinda to facilitate those meetings and to actually book those while the student was at school. And that gave us so much great access. And with that, the youth was actually able to go through the entire 8 weeks. And with those interactions and that building that self-trust with, adults and learning to express herself, her grades improved and her attendance improved. She got a bunch of gift cards for doing it. And it turned out to be a really awesome experience. And that was all facilitated by our ability to collaborate, us being virtual, them being on site, making this happen. And so I just wanted to highlight the importance of the collaboration in that way, because outside organizations like us, we don't always have the best access to the students while they're in the school building. And sometimes if there's technology concerns, or if maybe mom and dad aren't going to be the kind of people to set up the meetings at home, it's hard for us sometimes to help people when we want to. And so it was cool. This student ended up moving out of state, and we were able to support her through that as well. So this was kind of like the poster child example of what it's supposed to look like. Next slide, please.
Okay, so I met this student when I was working at the high school before I took the position as a liaison. And so we had already had a base of a relationship. And when she started getting involved in the Chase program, Heather and I talked about what would be a good time. We didn't want to take her out of any of her core classes. So we met her during Tiger Time, which was a time for students to catch up on their work that they needed to do. So that worked out really well. And the school was very, very supportive. And Heather and I would help to facilitate her meetings at school during Tiger Time. Sometimes I would meet with her, sometimes Heather would. And we also, Heather and I, worked together to provide transportation to events and things that the student needed to get to. And then just the open communication. Heather and I share an office, so it made it very easy. Heather went in her home more than I did. So Heather was able to give Brad heads up about what was going on, what topics to touch with her, and just the collaboration made the student very successful and gave her a lot of self-confidence to move forward and not feel stuck, especially after losing her mother. So it was a great opportunity and a great success.
And when she graduated the program, Brad and his team put together a pizza night at Common Grounds here in Fort Scott, and we had pizza, and she got her certificate. So it was a great evening, and he had live music there for her and everybody that attended. So it was just a great collaboration for the student.
Yeah, she was really proud of herself.
Yeah, she was.
And her grandma came, and it was a great time. Next slide, please.
Okay, our next case is about 3 siblings. They are twin boys, ages 12, and a girl who is 15. 2 out of the 3 of them are juvenile justice involved. One, the girl is on diversion, and then the other sibling is just going through the juvenile justice system regularly right now. Their behaviors at school led to suspensions, poor grades and attendance, and there was a lot of lack of support from parents. I would try to meet with the family and the parents. I did meet with mom one time, but it's very difficult to meet with dad. But I felt it was important that these three be involved with the CHASE program, just to give them a better lease on life and put something positive in their life so we can see them just improve overall. So next slide, please.
So some more progress with this group. The first off, it was cool because it was only one of the twin boys that was in the program initially that was referred to us, and the family actually traveled from Fort Scott up to Kansas City to go to a bowling event, and that was probably an 1.5-hour drive or so. And the other twin and the sister, after interacting with our team and getting to meet some of the other families, and I got some really good FaceTime with the dad, the other two siblings ended up being referred after that. So that just goes to show the power of in-person interactions at a community event. And that's all good and well, but when you think about it, we have at least 8 to 10 meetings with each person in our program. And so now we've gone from 8 meetings with one student to 24 meetings with 3 students on top of everything else we do. And so speaking to the Swiss Army knife nature of these folks, you know, we rely on them to facilitate those meetings and to do some of them in school and some of them in the home, like we alluded to in the last example. And that was so helpful for us to maintain consistency with all 3 students. Also, we worked as a team to schedule a meeting with the school to actually get one of the boys back in the building. His brother was allowed to be in the building. One of the other boys wasn't doing as well behaviorally, and so he wasn't allowed to be in the building. But we initiated a meeting with the school, and all of us came together to troubleshoot around his issues. He was falling asleep in school. And so we talked about, well, let's try a weights class first thing in the morning and see if that wakes him up a little bit. And, oh, you know, dad works in the morning. That's okay. We have a community health worker that can help with transportation to the building. And so largely our work is about helping people, but it's also about personal agency. It's about creating more options. And, you know, hoping that the families take the best options that we help them, you know, with, but we're able to, as a team, create so many more options virtually, in person, transportation, community events, like that we really are able to bolster their ability to have access to the resources that they need, which we're really proud of. And this family still is, you know, maintaining relationships with us today. I was just joking with the team before this. I got an email from one of them earlier today from his school account, and it said, "What's up, Brad?" in all lower caps. It was just kind of funny. It's just classic. But yeah, cool family. We love working with them, and they're also instrumental in our community garden, which I'm going to pass it to the next slide for Belinda to talk about.
Yeah, the one student that couldn't come back to school, the CHASE program, and then I was able to connect with the dad and connect him with mental health services. So those were all pieces that helped this child be able to come back to school and be successful last semester. So part of our collaboration was the community garden, and Heather and I got the school van, and we drove out to the house, and the one twin came out and hopped in the car, and the other twin finally came out the door, and he and Heather were arguing back and forth about getting in the van, and he wasn't going to come, and Heather had to hop out and talk to the sister and get her in the van. And meanwhile, I was able to de-escalate the one child and convince him to get in the van. And he's like, I'm not going to come. I'm going to run away when I get there. And I said, well, and I changed the subject and we talked. And so I thought, how am I going to get him to do it? So I used Sonic. So I said, hey, everybody that works in the garden, we're going to go get a Sonic drink. What do you want? So the sister and the brother told me what they wanted. And I asked this student, I said, well, you gonna help? You want a Sonic drink? And so he's like, yeah. So I invited him to ride to Sonic with me because I couldn't handle all the drinks by myself. And by the time we got to the community garden, he was ready to go and got a shovel and participated. And so all of that is collaboration. We got there, Brad was positive, the team was positive, he got involved. And the mom works across the street, so here she came. So the kids were all proud to show mom what they've done. So it was a wonderful time, a great opportunity. And it aligns with the mission to create pro-social opportunities, community connections, and access to healthy food. So the other thing, we were featured in the paper, Fort Scott Tribune. So yeah, it was a great time, and I'm happy to be part of a team that makes a difference in these kids' lives.
I also want to say that these kids enjoy this so much that there's a session where they have to stand up and they have to be their superhero, and we are in the middle of the commons area at the schools, and they are up doing this in the middle of the commons area, and they don't care who's looking at them when they're doing this. So that is how engaged they can be in this program, which is just great to see. Next slide, please. Now I'm going to pass it over to Colette Lee, who is my boss.
Thank you, Heather. First of all, I just want to say, before I even start into my slides, is I want to say thank you to Heather, Belinda, Chase, and Brad, because you guys are doing the work. Your feet on the street, you're doing it. I'm going to kind of transition to a different level of more of a support is what I am going to be speaking about today. My name is Colette Lee. I am the Director of Patient Engagement here at Community Health Center. I oversee 40 plus community health workers in different specialties, such as Heather. Heather has a specialty in all of our schools and does an amazing job. I also get to work with another 5 community health workers that are in schools. So it's just a wonderful thing to be a part of. Next slide, please. So community health worker work is very hard, just like they were talking about, being I always like to call them my utility players, because if I ask Heather one day, I need you to be the pitcher, and then the next day I need her to be, the person bunting the ball, she does it. And that's what it's about. We understand that our community health workers come from all ways of life. We have some that have master's degrees, educational master's degrees. We have some that have master's degrees in life, and we have some that have them both. So they come from all over, and that's what makes us so special, is because we all have a piece that we bring with us that's a little bit different. Belinda's piece is different than what Brad's is, and Brad's is different than Heather's, but coming together as a community, that's what makes us whole. That's what makes us who we are, completely. Community health workers, I want to really focus this talk on how we can help support, because I know that they shared some beautiful stories today, which I love to hear, but we also know that this work is very hard, and it can kind of wear on you if you don't get the right supervision and the right support from your supervisors, from your community. So some things that I have learned over the past several years of being able to support our community health workers is understand their why. Why, my why or Heather's why is going to be different than Belinda's why, and so forth. So I like to learn their whys. I like to learn about them because then I get to foster that. I can foster that through more educational opportunity, more community opportunity. I tend to kind of see what community health worker kind of goes. So I know, like with Heather, I will always have her work with Brad because they have that connection. It's meeting with those partners and connecting them together. So then that way we can keep that connection going and get our students, our teachers, our staff into the right people. For our community health workers, we provide one-on-ones. Our supervisors, I have 3 managers that kind of oversee with me our community health workers. They give that full attention to them. What's going on? Because we have to understand too, a community health worker can say that they're fine, but it's about really watching what's going on. We have to pay attention to their body language. When you're dealing with students that, for instance, they won't get in the van, and you're just like, sometimes it can be frustrating, and sometimes you're just like, what am I doing? Why is this not working? It's good to have that support person to say, hey, you're doing all the things that are right, and we are so proud of you. And you know what, you did absolutely great work today, because we find ourselves kind of feeling like, why couldn't I do that next thing? Why couldn't I have done this? And the thing of it is we have to stick by each other. So always follow their voice, their demeanor, really learn your community health workers, learn your partners, because again, you know, your partners are where it's all at. I like to form that connection from the beginning, like I said, and group support is a big one too. Not only do we provide one-on-one support with our community health workers, we come together as a team. We bounce things off as a team. I always say, you know, we're never an island. You know, Heather is in Bourbon County. She has other community health workers in Bourbon County, but she also has 60 other players that are with her that she can pull at any given time. So I find that to be extremely helpful too. Next slide, please. So this is a big one where I kind of fall into this between all the fantastic work that you had seen today. I fall in the very beginning of it. I meet with the district at the very beginning before we put a community health worker or instill the right community health worker in that district. I knew Heather was the best community health worker for that district because I learned what the district needed. That is my job, is to go in and really make that connection with administration, with the principals, really listen to the teachers, listen to the students, what's going on. That way, whenever we are going to hire for that position, we can find that right person. So again, you know, Heather is so different than my other, and every school district is different. And we know every community is different. So we need to definitely hire for that community and for that partnership community piece too. I like to spend time with the districts because every district, like I said, is different. Some, it's a lot about pest control resources or truancy issues. Is there food insecurity? So I kind of figure out what that is. And then we provide those other resources for these things for the families as they come up. I like to stay connected. We stay connected with our schools and really be there real time. I find that this is good to be virtual because we have so much opportunity when we're virtual, but there's something to be said about really seeing your partners face to face and really spending that time together, building those relationships. Like Heather had mentioned, which I love, this has been just implemented across all the districts now that we have the pleasure of being in, is that we are working to where at once a month we all meet as a group of resources and really hone in on those kiddos that really need that extra support. We have found what happened before was, let's say, for instance, Spark Wheel was working with a kiddo and Heather was working with the same child, but they were not connecting. They were not communicating. So how are we helping a student except causing more confusion and causing, you know, not spending our resources the way that we should? So now this gets everybody in the same room. We get the opportunity to really hone in what that family needs, and then we go after it. And I think today you guys can definitely see with MHIT, with Chase, with Community Health Center, with Telehealth ROCKS period, that coming together and really seeing each piece kind of work and evolve. I like to think of it as a wheel, and we have spokes in the wheel, and that's what's running everything. So that's where we do the district monthly resource connections. Like I said, we like to really have a full house of the resources there and really talk so we're not duplicating work. Next slide, please. So what you're about to see, we're very proud of. We have worked really hard. We have learned a lot in the last several years that we've all been together. We have learned one of the biggest pieces, and I know some takeaways too for the folks that have presented today, is that, you know, we did get some feedback of, oh my gosh, you know, this community health worker is trying to take my job. No, we're a community and we have to stand together, and that's the only way that we're going to be able to do this is together. So that was the biggest thing that we ran across is, oh, I don't know. But then as soon as Heather walks through the door, they're like, I love her. Can I have like 3 of her? I hear that a lot throughout. I know that community health workers do so very much. And I just want to say thank you to Heather and Belinda, Brad and Chase for making this possible. So I just want to share the movie today, and here we go.
More community health workers would make such a huge impact in our community because there's such a great need because of the high poverty and because of the lack of services that we have here.
CHWs are here to help get kids to be kids again, helping teachers get back to teaching and ease the burden off of the teachers and the families.
A community health worker is the translator for everybody that's involved in the student's care. Every district is a little bit different, but my role is to learn what the need is, and then that community health worker will go after that.
We do anything from getting a kid insurance to hygiene items because they didn't get that done in the morning. We have a care closet if they need clothing, to helping with rental assistance for the families. I have parents that call me instead of calling the school first to be like, hey, could you address this with admin? I just don't feel comfortable. And we do that, and it really builds a good connection with the family.
It's really like a domino effect because you don't realize something as simple as a bed, something as simple as healthy food versus junk food, that can make a child's entire learning so different.
Having a community health worker in the school means I have partnerships within the community. I'm that one that can go in the home and work with the student and the family to ensure the kids are safe, the family is safe.
Anything that benefits the family and the kids will help the kids get to school and have a better education while they're at school. So I'm the director of our Food for Kid programs we offer also through the Kansas Food Bank. And every Friday I make a list of the students that meet the needs and requirements, get permission from the parents, and we'll send it home with the student in their backpack so they have a meal and a snack to get them over the weekend until they get back to school to make sure they have the food that they need.
I've just noticed that we have kids who have really struggled trying to get their behaviors under control, and I've seen those kids make progress, and then at the same time they start having success academically. Our achievement is going up. I'm just really thrilled with the progress we've made.
One of the rewarding aspects of my job is just to see the families grow. It just benefits the students and the community as a whole.
I grew up here in this community, and I was one of the kids that went through poverty in the school systems here. So I know what a lot of them go through, so I can be that extra support to get the kids the help that they need and the families the help that they need.
My top suggestion for anyone considering a community health worker in their community would be open your doors.
As a community of people, we can make change, but we have to work together and we have to understand each other.
So I'm going to go ahead and give it back to Chase. Chase, do you want to go ahead and take it from here?
Yeah, definitely. Thank you, Colette.
Thank you.
So we just want to emphasize that school-based CHWs are not the solution. We know that we need to build a system of supports like we've talked about in this presentation, and like Colette was talking about, building a system of supports around the CHW. And that's going to be a bigger transformation needed to create a trauma responsive and inclusive community. Next slide, please. So now we're going to go ahead and open it up for questions. If you could put your question either in the chat or in the Q&A function, that way we will have a record of all the questions asked. If we can't get to any, we will make a list of those and send them out in our follow-up responses. Okay, Heather, I did see a question in the chat asking about any work that you do with families on civic engagement, such as voting and voter registration. Could you speak to that?
Yes, I can do that. If I have a family I'm working with, and if I'm in the home, because if I'm in the home, I can see a lot of different things. So if that's something that's a concern of theirs, I can definitely assist them with that and any other thing that they may need help with. Also, if the family's involved with the CHASE program, they can get involved in family events within the community. So yes, since I'm in the home, I can see everything and I can help with any need that they may have.
So yes, we are a grant funded program. Telehealth ROCKS is federally grant funded. And I'm reading the second part of that question. So how large is the average team in a school? I can let maybe Colette answer that just from the larger school-based community health worker and school-based team. And then maybe Heather can give the Fort Scott perspective as well.
So community health center is a little bit different than most health centers because Heather, like I said, she's in the school, but she also has behavioral health. A lot of our behavioral health therapists will be in the schools. We will also have the nurses are also part of Community Health Center of Southeast Kansas. So really she has more than just herself. And then we have community-based community health workers that she can rely on too. So I know that doesn't really answer your question too well, but typically we have one community health worker per school, except for USD 250. They have two. Yes, we partner with the school districts. That's what we do. Community health does. Chase, do you want to get on the Telehealth ROCKS part?
Yeah, so like I said, Telehealth ROCKS has 10 school-based CHWs. So we use different models across different school districts. So like Colette was saying, in the Fort Scott School District, Heather is employed by CHCSEK, the regional FQHC. They also employ other school-based community health workers for the Telehealth ROCKS program. We also have a regional CCBHC that employs one of our CHWs, and they are spread across 3 school districts. And then we also have a school district that employs 2 of their own school-based community health workers. So that's a direct relationship that we have with that school district. Okay, I'm not seeing any other questions come into the chat. So we can go ahead and go to the next slide. Okay, so we just wanted to say thank you guys so much for attending our session today. We did have the QR code there that will take you to the Telehealth ROCKS website, as well as our contact information. So if anyone has any additional questions that they want to send to any of the presenters, you can use the email address either listed there or follow that QR code for our contact information, and feel free to reach out to us and we will make sure we get those questions to the presenter that it needs to go to. And like we put into the chat, we will send our presentation slides and answers to any questions out in our follow-up resources. But again, we just want to thank you so much for taking the time today to listen to the comprehensive work that's happening in the Fort Scott School District. We know that there is so many other people that are at the table in that community and in rural communities across the state of Kansas and across the United States. So we really just wanted to give you guys a snapshot of the work that's happening in the Fort Scott School District. All right, I think you can go to the next slide. I think that's it.
Great job, guys.
Great work, guys.
Great job, guys.
Yeah.